My name's Sarah. I'm one of the specialist refractive optometrists at Optical Express. My role started off as being one of the NHS optometrists working in small community practices, doing regular NHS eye tests and contact lens checks. I then proceeded to do my refractive training, which started off with me doing post-operative appointments, and then following on from that I then did my pre-operative consultation training to be a full specialist refractive optometrist. So what that involves is it involves assessing a patient to see what they'd be suitable for, and then putting them forward for surgery and going through the outcomes and the procedure of the surgery. The refractive training programme was really interesting because I came into St Vincent Street and I met with some of the senior colleagues here, and what they did was they taught me how to assess a patient properly and to do their post-op appointment. And then I was here for the week, so I got to see how the clinics worked and how it worked alongside with the surgeons. And then after that, once I got back into clinic and did my own post-op appointments, I then came back and did another week of training, again where I watched other optoms and then got to see some patients myself. I've developed a lot since working here, so I started off in my old job as well, just doing NHS work in contact lenses, which can be quite samey. And then when I started here, I did my kind of surgery training, and the pre and post-op consultations are much more in-depth. You learn a lot more about your job, which then helps you when you go back to do NHS sight tests, so you pick up more eye conditions and things quite quickly. I've also done the independent prescribing course with Glasgow Caledonian University, and working here allowed me to do my hospital placement, or part of my hospital placement, in the clinics here. So that also meant that I could do that in work as well, which helped. The level of support here is really good, so as much as you're in clinic seeing the patients yourself, there are various ways you can get in touch with other clinicians for a second opinion. So we have the second opinion email address where you can email in, and a senior colleague will pick up the emails and give you their opinion on it. And there's also a hotline number that you can phone during the day, so if you're struggling with anything or you have a question about anything, you can just phone the number as well. The nice thing about working in the surgery centres is the ophthalmologists are always there as well, so you can actually just ask one of the ophthalmologists that we have in-house as well, which is really helpful. My job at Optical Express is very varied, so we see patients right the way through their surgery journey. So right from them arriving and wanting to have refractive surgery with us, we then see them, assess them, see what they'd be suitable for, and then put them forward. They would then go on to have their surgery, and then again we would see them back for their post-operative assessment. So it's really nice to see the patient coming in either glasses or contact lenses, and then leaving glasses free after you've put them forward and recommended something for them. Each day is different. So some days you're just doing NHS tests, some days you're doing contact lenses, and other days you're doing kind of surgery stuff and looking after patients after they've had surgery and treating them for various things. So each day is different here. Familiarise yourself with the available directives on the internet, so as long as you know what's in them, then you can't really go wrong about how to assess a patient or put them forward. If you ever need help, ask. The senior team are more than happy to answer any questions, and they'd rather you ask than you kind of worry about it and get it wrong. So everyone here is really nice and more than happy to help. So as long as you're familiar with the guidelines and what the guidelines are that the ophthalmologists have set, then you'll be absolutely fine.